If there's one thing you should be eating every single day, it's something that can actively work to clean out your arteries, stop new plaque from forming, and here's the part that might genuinely surprise you, even help reverse plaque that's already there. But before we get to that, I need to clear up a massive misconception that most people carry around about heart attacks. It's one of those things that sounds logical on the surface, but once you understand what's actually happening inside your body, everything changes. Most people believe that a heart attack happens when an artery gets so packed with plaque that it basically seals shut, like a clogged pipe. That picture seems intuitive, but it's largely wrong. Here's what typically happens in reality. The artery doesn't have to be anywhere near fully blocked. In fact, you can have as little as 20% plaque buildup, a relatively small amount, and still suffer a fatal heart attack. The reason comes down to the type of plaque involved, because not all plaque is the same. There are two distinct kinds. The first is hard plaque. This has undergone a process called calcification, which essentially means it has hardened and become structurally stable over time. Hard plaque is actually less dangerous precisely because it stays put. The second type is soft plaque, and this is where the real danger lives. Soft plaque is unstable. It sits beneath a thin, fragile cap inside the artery wall, and when that cap ruptures, which it can do even with a minor amount of buildup, it's like cracking open a wound inside your blood vessel. Your immune system immediately detects this rupture and floods the area with clotting agents. That clot, not the plaque itself, is what physically blocks blood flow to the heart. That's your heart attack. And yet, when you go to the doctor and your blood work comes back showing high cholesterol, the immediate response is almost always to prescribe a statin. Cholesterol gets handed the blame. But as you're about to see, that blame is dramatically misplaced, and misunderstanding it has led millions of people to treat a symptom while leaving the actual cause completely untouched. To really grasp what's going on, you need to think about two completely different stages of this disease process. Think of it like a river. There's the downstream, where the damage is already visible. That's where plaque accumulates, where symptoms show up, where heart attacks happen. That's where medicine almost exclusively focuses. But then there's upstream, the sequence of events that set all of this in motion years, sometimes decades, before any symptom ever appears. And this is where the medical system has a critical blind spot. This problem doesn't build overnight. It brews silently for 10, 20, even 30 years or more. By the time a person gets a diagnosis or experiences a symptom, the upstream damage is already ancient history. But if you don't address what's happening upstream, you will never actually solve the problem, no matter how many medications you take. So let's go upstream. Let's start at the beginning. Inside every artery, lining the interior wall, is an incredibly thin layer of cells called the endothelium. It's almost impossibly delicate, and it plays a vital role. It keeps the blood flowing smoothly, prevents harmful substances from penetrating the artery wall, and regulates a molecule called nitric oxide, which helps the artery expand and contract naturally to manage blood pressure and circulation. This inner lining is your body's first line of defense. Now imagine someone taking sandpaper to the inside of that wall. That's essentially what certain lifestyle factors do. Chronic smoking does it. Chronically elevated blood sugar, the kind that comes with insulin resistance, usually driven by eating too many refined carbohydrates over too many years, does it. And so do the chemical ingredients hiding in ultra-processed foods, the industrial seed oils, the artificial additives, the preservatives. All of these act like that sandpaper, slowly abrading and irritating this delicate endothelial lining. Over time, this persistent irritation creates actual damage, tiny lesions, micro wounds inside the artery wall, and the moment that damage appears, the body launches its repair system. Inflammation kicks in, and white blood cells are dispatched to the site to begin healing. This is where the cholesterol story gets far more nuanced than most doctors have time to explain. When you get your standard cholesterol panel at the doctor's office, you typically see three numbers: total cholesterol, HDL, and LDL. You've probably heard HDL called good cholesterol and LDL called bad cholesterol. But that framing is dangerously oversimplified. HDL's job is to act like a cleanup crew. It picks up cholesterol from tissues and carries it back to the liver for processing. That's why it gets the good label. LDL, on the other hand, delivers cholesterol outward to various parts of the body. And yes, there are situations where that causes problems. But here's what almost no one tells you. There are two very different types of LDL particles, and they don't behave the same way at all. The first type is called large buoyant LDL. These particles are big, round, and they glide through the bloodstream without causing trouble. They don't stick to artery walls. They don't get lodged anywhere. They're essentially harmless in terms of cardiovascular risk. The second type is called small, dense LDL. These particles are compact, hard, and they behave completely differently. Because of their size, they can slip into the damaged endothelial lining of an artery wall. Once they're embedded in there, they become oxidized, meaning they undergo a chemical change that turns them from ordinary particles into something your immune system reads as a threat. Here's the critical problem with standard blood tests. When your doctor measures your LDL, they're measuring a combined number, large and small particles lumped together. That number tells you almost nothing about which type is dominant. If most of your LDL is large buoyant, you might have a high total number and still be at low risk. But if small, dense particles are the majority, even a normal LDL reading can be masking serious danger. This is why, if you're concerned about your cardiovascular health, it's worth asking your doctor specifically for an advanced lipid panel, sometimes called an NMR lipoprofile, which breaks down the actual particle sizes. That's the test that tells you something meaningful. Now, back to those small, dense particles that have become lodged in the artery wall. The immune system sends in a specific type of white blood cell called a macrophage to deal with the threat. The macrophage's job is to engulf and neutralize the oxidized LDL particles, to literally eat them. The problem is, macrophages don't know when to stop. They keep consuming and consuming until they become completely bloated with oxidized cholesterol. Under a microscope, these overstuffed cells look foamy and swollen, which is why scientists named them foam cells. Eventually, these foam cells die, and when they do, they leave behind a kind of graveyard inside the artery wall. Not just cholesterol, but dead immune cells, inflammatory debris, and calcium deposits that your body uses in a desperate attempt to patch over the area. That collection of dead cells, oxidized lipids, and calcium is what forms soft plaque. It builds up beneath a thin, fibrous cap. And when that cap gets stressed or inflamed enough to rupture, that's when the clot forms. That's when you have a heart attack. Notice what's actually in that plaque. Dead white blood cells, inflammatory debris, some cholesterol, yes, but as a secondary player in the process, not the primary cause. So when a statin comes along and simply lowers your LDL number, it does nothing to address the foam cells, the immune reaction, the inflammation, or the debris field sitting inside your artery wall. The root cause remains completely intact, and the data backs this up. A landmark UCLA study, one of the largest of its kind, examining over 135,000 people who had been hospitalized for heart attacks, found that an astonishing 75% of them had LDL levels that were considered perfectly normal. Let that sink in. If 3 out of 4 heart attack patients had normal cholesterol, how can we honestly keep telling people that cholesterol is the cause? The real cause is upstream, and it's this. When a person chronically overconsumes carbohydrates, particularly refined carbohydrates and sugars, the liver gets overloaded. It converts the excess into triglycerides, the storage form of energy. When triglycerides are chronically elevated, The body produces more small, dense LDL particles. More small, dense LDL means more particles getting embedded in damaged artery walls. More embedded particles means more oxidation, more immune response, more foam cells, more plaque. This is the chain. Excess refined carbohydrates leads to high triglycerides, leads to small, dense LDL, leads to arterial damage, leads to inflammation, leads to plaque, leads to heart attack. Cut off the chain at the source. By reducing refined carbohydrate intake and addressing insulin resistance, and you change the entire downstream trajectory. But instead, most people are handed a statin prescription and told to watch their fat intake. It's a solution aimed at the wrong end of a very long chain. Speaking of statins, let's talk about them directly, because a study was recently put forward claiming they're far safer than previously reported, with only around a 5% risk of muscle-related side effects. That number sounds reassuring, but when you look more carefully at how that study was conducted, several serious red flags emerge. First, the organization behind the study, the CTT, or Cholesterol Treatment Trialists Collaboration, has repeatedly refused to release the raw data from their research. Despite years of pressure from independent scientists and researchers, the underlying numbers have never been made publicly available for independent verification. In any field of science, the inability to replicate or scrutinize a finding is a major problem. We've seen this pattern before with medications that were declared safe for years, only for lawsuits to emerge later when the hidden data finally surfaced. Second, the CTT has received substantial financial contributions from pharmaceutical companies, reportedly in the range of $200 million. When the organization funding and conducting the research on a drug has significant financial ties to the companies selling that drug, we have a textbook conflict of interest. Third, and this is perhaps the most technically deceptive part, the study used something called a run-in period. Here's what that means. Before the researchers even begin officially tracking outcomes, they put all participants on the drug for a preliminary period. Anyone who develops significant side effects during that pre-study phase gets quietly removed. Only the people who tolerate the drug well are carried forward into the actual study. By the time the official data collection begins, the most vulnerable participants, the ones most likely to experience harm, have already been screened out and excluded from the results. That's not an accident. That's a methodological choice that systematically skews the outcome toward making the drug look safer than it actually is for the general population. Observational studies conducted outside of this controlled, pre-screened environment consistently show a much higher rate of side effects, particularly muscle damage and pain, cognitive issues, and increased diabetes risk. There's also a biochemical cost that often goes unmentioned. Statins work by blocking the enzyme your body uses to produce cholesterol, but that same biochemical pathway also produces coenzyme Q10, a critical nutrient that your mitochondria depend on to generate energy. Your heart is one of the most mitochondria-rich organs in your body. Depleting CoQ10 while prescribing a drug intended to protect the heart is a troubling contradiction that deserves far more discussion than it currently gets. So, if statins aren't the answer to soft plaque, what is? This is where we get to the part that should genuinely excite you, because the research here is both surprising and incredibly encouraging. Aged garlic extract. Now, I know how that sounds. Garlic. But stay with me, because this is not folk medicine or vague traditional wisdom. This is randomized controlled trial data, which is the gold standard in clinical research. 2 separate randomized controlled trials tested aged garlic extract at a dose of 2,400 milligrams per day and used coronary angiography, detailed imaging of the arteries, to track what happened to plaque over time. The results were remarkable. It didn't just slow the progression of soft plaque. It didn't just stabilize it. It reduced it. The amount of soft plaque measurably decreased in patients taking aged garlic extract. That's a profound finding because very few interventions, pharmaceutical or otherwise, have demonstrated the ability to actually reverse soft plaque accumulation. Why aged garlic specifically, as opposed to regular raw garlic? Both forms have real health benefits, but they're not identical in their effects. Fresh crushed garlic is genuinely effective at reducing blood pressure, thinning the blood, and supporting healthy clotting function. These are meaningful benefits, but the specific effect on soft plaque reduction has only been demonstrated with the aged extract, a form that undergoes a special curing process over many months, which transforms certain sulfur compounds and concentrates particular bioactive substances not found in the same concentration in raw garlic. One important note, because aged garlic extract does have mild blood thinning properties, if you're already taking a prescription blood thinner like warfarin, you need to discuss this with your doctor before adding it to your routine. It's not a reason to avoid it, it's simply a reason to coordinate. Beyond aged garlic, there are several other evidence-supported strategies worth knowing about. Exercise, particularly outdoor physical activity, is a powerful stimulator of nitric oxide production. Nitric oxide, remember, is what keeps the endothelium flexible and functional. Sunlight exposure during outdoor exercise has its own additional benefits for cardiovascular health, including vitamin D synthesis. Magnesium is critically underrated in cardiovascular health. It serves as a cofactor in hundreds of enzymatic reactions, including those that power the mitochondria in your heart muscle. Just as importantly, magnesium plays a key role in preventing the inappropriate calcification of soft tissues, meaning it helps keep calcium going into your bones where it belongs, rather than into your artery walls. Cod liver oil, a form of omega-3 supplementation, has also shown some evidence of helping reduce soft plaque accumulation, though not to the degree that aged garlic has demonstrated. What makes cod liver oil particularly worthwhile is that it delivers not just omega-3 fatty acids, but also natural vitamin A and vitamin D in biologically active forms. This combination of benefits makes it more valuable than a standard fish oil capsule for most people. Intermittent fasting is another tool with profound upstream effects. By giving your digestive system and insulin signaling pathways extended rest periods, intermittent fasting helps lower chronic inflammation throughout the body and significantly improves insulin sensitivity. Since insulin resistance is one of the primary upstream drivers of small, dense LDL production and endothelial damage, addressing it through fasting can have ripple effects throughout this entire chain of events. And finally, reduce refined carbohydrates. This is the most direct lever you have over the production of small, dense LDL. When you lower the carbohydrate load on your liver, triglyceride levels drop. When triglycerides drop, the ratio of large to small LDL particles shifts in your favor. More large buoyant particles, fewer small dense ones. Fewer small dense particles means less arterial infiltration, less oxidation, less immune activation, less plaque formation. This is not a marginal effect. It is the foundation. Let's zoom out and look at the full picture of what needs to happen. The upstream events, endothelial damage from smoking, high insulin, processed food chemicals, set everything in motion. Address those, and you change the environment your arteries are living in. Then the next layer is about what's happening in your blood. Too many small, dense LDL particles, driven primarily by excess carbohydrates and elevated triglycerides. Address those, and you cut off the supply of particles that would otherwise become lodged in your artery walls. Then comes the immune response, the foam cells, the inflammation, and this is where aged garlic extract and other anti-inflammatory strategies like omega-3s and intermittent fasting make their biggest impact. And finally, there's the plaque itself, soft, unstable, reversible with the right interventions, and hard, calcified, stable, and not something that typically requires intervention at all. Most conventional medicine operates only at the very end of this chain, trying to manage a number on a blood test that's several steps removed from the actual problem. That's why so many people follow their doctor's advice, take their medication faithfully, and still end up with heart disease. Not because medicine is corrupt or negligent, but because the system is oriented toward disease management rather than root cause resolution. You don't have to accept that framework. You can work backward through the chain, address each layer with targeted strategies, and dramatically reduce your risk. Or, if you're already dealing with soft plaque, potentially begin reversing it. The non-negotiables for most people come down to this. Get an advanced lipid panel to understand what type of LDL you're actually dealing with. Reduce refined carbohydrate intake significantly. This is the single most impactful dietary change most people can make for their cardiovascular health. Add aged garlic extract at a clinically meaningful dose. Consider magnesium, cod liver oil, and intermittent fasting as complementary strategies. Move your body regularly, preferably outside. And think seriously about what in your daily environment is chronically elevating your insulin, because that is the sandpaper on the endothelium, day after day, year after year. The arteries you have in 20 years are being shaped by the choices you make right now. The good news is that the body is remarkably resilient when you give it the right conditions. Soft plaque can be reduced. Endothelial function can improve. Insulin sensitivity can be restored. Inflammation can come down. None of this requires extraordinary willpower. It requires understanding the actual problem clearly enough to address the right things in the right order. That's what this is really about. Not a single superfood, not a magic pill, but understanding the chain, from endothelial damage all the way to the clot, and intervening intelligently at every level you can. Start upstream. Everything else follows.